I do see that it is the hour mark, and in the interest of getting to as many questions as humanly possible, I'm going to start right away. Hello, everyone. My name is Kevin Schnurr. This is the Patients and Caregivers live Q&A, so you're in the right spot. I am an Alport patient, a living donor kidney transplant recipient, and I serve as the Director of Communications and Patient Engagement for Alport Syndrome Foundation. Ryan Landwehr is unfortunately unable to join us today, so I will be moderating this upcoming session. Just a few quick housekeeping notes. You will see and hear a prompt in the session that is being recorded. So please click continue upon seeing this prompt in the middle of your screen to accept the recording so you can remain live with us and participate in our live Q&A. Professional live closed captioning is available by clicking the CC button at the bottom of your screen. If you have trouble enabling it, just click on the app guide, which is found on the main page of your smartphone app. It's also available on the top of our browser link as well. The chat button is reserved only for ASF staff to not have any distracting messages. As this is a Q&A, we encourage you to use that Q&A button and Q&A button only to submit questions for our featured guests. We're also happy to have an accomplished book illustrator and live sketch artist, John Whitworth, joining us today. John will be sketching our conversation in real time, visually documenting important takeaways. His sketch will appear about every 10 minutes on your screen for a bit, so we can watch his progress together. You'll see his final sketch at the conclusion of the session. Now, on to the Q&A. Before we begin with questions, I'm just going to call each of our panelists by name and ask them to very briefly share a little bit about their Alport syndrome journey, and then we'll get right to all your questions. First, I'm going to start with Sarah. If you can just give us a very quick, maybe 30 seconds overview of your Alport syndrome journey.
Okay, so I inherited Alport syndrome from my father, and I have the female version, and I was diagnosed when I was 14, and I was on dialysis for 4 years, and then I just recently received my kidney transplant about 4 months ago.
Congratulations on that, Sarah. Todd, let's hear from you.
Yeah, congrats, Sarah. That's great. Yes, Todd Goldrick. Good afternoon, everyone. Same as Kevin, living donor recipient in 2014. So I was diagnosed officially in 2010 with Alport syndrome, and in 2014 received a kidney from my best friend, actually, and so 7 years now. I just celebrated 7 years in May.
Fantastic. Eric, let's hear from you.
I was diagnosed in 1999, so I'm late life. Kidney failure. I started failing about 4 years ago. I've been on dialysis for a year and a half and waiting for a transplant. I've been involved in 2 other studies through Alport syndrome. One of those a drug study.
Thanks for sharing, Eric. December, let's hear from you.
Hi, yes, my name is December West. I'm a parent of a child with Alport syndrome. She has autosomal recessive. She was diagnosed when she was 7, but she started having kidney problems when she was 3. And she went through the, thing as they talk about all the time, that we had a couple different diagnoses, but she finally was diagnosed with Alport when she was 7, and she's 10 now.
Thank you for sharing, December. And lastly, Patient.
Hi, my name is Patient. You can just call me Pei. I was born in Taiwan, and initially I was misdiagnosed with IgA. At the age of 12, when I was in Australia, my nephrologist performed a biopsy to finally confirm that I was X-linked Alport syndrome. And 20 years later, I'm still in preserved kidney function mode. Thanks.
Okay, great. We have a few questions that actually came in advance of today's meeting. So before we get to our questions that are coming in from our live audience, I wanted to ask a question of December. This is such an important topic. December, can you talk a little bit about why it's important to treat your adolescent daughter like an adult when you talk about just living with Alport syndrome, or maybe when she's in the room with her nephrologist? Why do you treat her like an adult and not necessarily like a child?
Well, the first thing I would want to say is, how would you feel if you were in a room and the doctor was poking you and you had to get blood drawn, or if you had to get a biopsy? How would you feel if no one told you what was going on? So for me, my daughter, she was always inquisitive when she was younger. So I felt that it would make her feel scared, not knowing different things. And the one thing I love about our journey is that, you just have to learn how to talk to them in, age appropriately. So like when she was 3, we would talk to her and let her know that, you have a kidney issue. you have to get blood drawn today. And just like, you know, it's an importance to build a good team, you got to make sure that you let her be a part of that team. Because as you know, this is something that is not cured yet. I know they're doing a lot of things in research now, but this is something that she's going to have with her the rest of her life. So the more that she knows, the earlier that she knows, that she can be able to help take care of herself, because in the event, if anything ever happened to her father or myself, you know, no one would know. So that's why, as for us, we always thought it was important for her to be involved. Like even today, you know, she knows her her diet, not diagnosis, she knows her dosage of medication. She knows what she's taking. She knows what she can and cannot eat, and she's 10.
Fantastic. Thank you, December. I want to move over to Sarah. This question is, what is it like to receive the gift of life in the form of a living donor transplant from someone who is so emotionally close to you?
It was surreal and just a crazy experience, because just growing that close to someone and then them feeling led to actually take something out of their body and give it to you is just incredible and so selfless and kind. It was honestly something that just changed like my whole mindset on other people.
Great answer. I mean, I am a recipient of a living donor transplant as well, and I agree with you, Sarah. It's hard to understand that someone else would be so selfless in wanting to do something that is admittedly complicated, right? It's it's a big surgery, but we both know what a big difference it can make in your life. And it's great to see someone like yourself as living proof that transplant is successful and can certainly improve quality of life. So congrats again, Sarah, on the recent transplant.
Thank you.
My next question is actually for Pei. You're someone who were diagnosed with Alport syndrome in your home country, and then you came here to the United States, and we know that there are many international guests tuning into today's session. Do you want to talk a little bit about maybe the biggest difference from having your diagnosis and maybe a treatment plan and a care plan in one country, and then moving over here to the United States?
I think one important aspect is having the resources, and this is where Alport Syndrome Foundation in the U.S. Came into perspective, because finding the right nephrologist, receiving the right care, and continuing that care is very important for all of our patients. And so that I really struggled when I first, for example, moved from Taiwan to Australia, or from Taiwan to U.S. of finding the right resources. So I'm glad that we have a foundation and we have a support group that can help us. And so finding the right resources is the most important aspect. Thanks.
Can I ask another follow-up question? How did you feel about maybe having a doctor who was, a member of your care team for so long and trusting in them, and then having to start over again? What was that experience like for you?
Luckily for me, I've still been in contact with my nephrologist in Taiwan.
Oh, wow.
So unfortunately, I have not been in contact with my nephrologist who I actually diagnosed my Alport syndrome in Australia. But in Taiwan, I can still write him emails. I can send him my labs that I do here in the U.S., and he's gladly volunteering to to look at my labs and even suggest what I may do, so I can bring in two sides of help from the U.S. and Taiwan to help out with my treatment plan. So
I think what's great about that, Pei, is you were probably taking advantage of telehealth long before it's become as common as it has now, in the pandemic. And it's great to see that you maintain that relationship with a nephrologist and are able to get that great help. We have a great question here in the chat from Kevin. And Kevin asked, how long did it take to receive a correct Alport diagnosis? And December, you touched on this a little bit before for your daughter. Would you mind just talking a little bit about misdiagnosis struggles that you encountered in your own family?
Well, when she was 3, she first was diagnosed with glomerulitis. Then she was diagnosed with IgM nephropathy. And then how we got to Alport's was she developed, and when I talked to her ENT, because I just started doing my own research, because at the time when I talked to her nephrologist, he said that he didn't think that her symptoms be that way. So when she hearing loss, the ENT said, well, he couldn't diagnose it, but he referred me to genetics, and that's diagnosis through genetics.
Great. Can I ask maybe either Todd or Eric if they faced misdiagnosis difficulties before arriving on that proper Alport syndrome diagnosis? Let me start with you, Todd.
Yeah, no, I don't think I was misdiagnosed. I mean, simply because, my grandfather had, and actually my aunt, went ahead and got genetic tested. So we already kind of had that suspicion. However, I will say though, my nephrologist, when I was in Minneapolis, they weren't convinced that I had Alport just because I didn't have the hearing loss. And so they were not convinced until they did biopsy.
What about you, Eric?
I've had hearing loss all my life. My kid's pediatrician, which is our family doctor, back in '99, had studied Alport syndrome in his internal medicine degree in college, and it was intriguing to him. So when he saw that my lenses were distorted in my eyes, he added that with the hearing loss as well as the protein and blood in my urine and sent me to a nephrologist. He actually diagnosed me with it close to probably 10 years before I had a nephrologist that knew about it.
Well, I mean, Eric, I think you raised an excellent point. Many of our attendees this weekend may not realize that it's not necessarily a nephrologist that gets that inkling that it's Alport syndrome first. We have seen ophthalmologists, we've seen audiologists and other healthcare specialists, and sometimes it's a matter of just connecting those dots. And then that's what ultimately gets the Alport diagnosis. So thank you for sharing that, Eric. There's a great question here now in our chat from Anna, and she appreciated December's comments earlier about how to speak to your children about Alport syndrome, and wanted to know what type of resources, if any, exist for facilitating that conversation. I am pleased to say that in the past few months, my colleague Lisa Bonebrake, who's our executive director at Alport Syndrome Foundation, has been working so hard on an incredible coloring book. It's our first ever Alport Syndrome Foundation children's coloring book called Annie Has Alport Syndrome. You can check out that. It's called Coloring Book. That feature is available, or that icon is available right inside the event app. And there's lots of details there on get your hands on one of those. We designed it for those, probably around maybe between like 5 and 11 years old. And it's a great tool to facilitate that conversation. And it's certainly a growing need to have a way to talk to youth about Alport syndrome. So I do encourage anyone with youth to check out that great resource, Coloring Book icon in our app. I have a few more questions here that came in advance. I would like to get to these as well. This one's for Todd. As a father, what have you done to help not project your fears about Alport syndrome onto your children?
Yeah, it's a great question. I'd almost like to say ditto to what December was saying, but I'll elaborate more. I think, being upfront and treating them like an adult is something that my wife and I have definitely used as well. I think, having the education from their standpoint is critical, right? And I think not just because of where they are today, but, there's going to be a point where they're going to be off in college and starting their own family, right? And I want to make sure that they're well prepared, in advance for those times. But at the same time, trying to understand it is real. But at the same time, that there's this open two-way communication between us and the kids, and my two girls, to be exact, have Alport. So I think it's really been that open two-way communication. But I think also too, they saw their father go through the transplant in 2010. They were young, but still they see that I still live a very active lifestyle. It is part of our life, but it's not our whole life. As we always try to tell them, that we try to really teach them about eating healthy. And things that they can do to prevent, some unnecessary things if they do arise. But I think it's really looking at it holistically and just looking at their overall health and making sure they understand that this is not a, death sentence. This is not like that at all. And really they understand the disease and take it, really take it serious too.
Great. Thank you for that.
Comment on that, Kevin?
Please. I was just going to direct the next question to you. So it's a perfect segue. Go ahead.
I have the opposite. I have two adult daughters. One's 21, one's about to be 23. They both have Alport syndrome based on blood and protein. One has hearing issues. We haven't had gene testing, but I've had a skin biopsy, which fortunately came back positive for X-linked Alport, so I didn't have to do a kidney biopsy. That was before I even heard about genetic testing, but my wife and I were just talking about this morning, that my girls treat it so nonchalantly, like is not important. And my one daughter has already had a daughter. And so far she's 18 months and not showing any blood or protein in her urine. So we're hoping that she got her grandmother's X and not mine. But they don't seem to understand the seriousness of it, especially her with her having kids, let alone the seriousness of what it means for me to be on dialysis. It's like, oh, he's on dialysis, he's fine, you know, nothing to worry about. They don't understand how much I have to worry about. So they're on the opposite end of the spectrum as far as I'm trying to project the fear onto them to wake them up and realize that they need to do the genetic testing. They need to have the genetic testing done on the children. So because there's a lot of things you can do to, you can't prevent kidney failure or problems like hearing and all that stuff because it's in the genes, but you can do things like do the blood pressure medicines. I can't think of the word right now.
ACE inhibitors, right?
Yeah, the ACE inhibitors and things like that. Watch your diet and your protein and your phosphorus and all the different things that you have to watch when you go into kidney failure. You can watch that ahead of time and be proactive on making your kidneys last longer and living a healthier life.
Yeah, absolutely, Eric. You raise a great point. You know, we know that earlier diagnosis and treatment certainly leads to the best outcomes. The question I was going to ask you before we started talking about your daughters, to kind of correlate to that, is most Alport males do experience like an aggressive renal decline in their lives. And you're certainly someone who did not encounter that in your youth. So as someone with like a much later progression of your disease, were you grateful for the extra time to mentally prepare, or do you maybe wish that it had happened earlier in life and you were maybe on the other side of things now?
Yeah, it looks like I have a missense mutation. I would, based on what I know preparing for transplant, they don't last forever. Someone that would have had, if I would have had a transplant in my late teens, early 20s, I'd probably be looking at my second or third or fourth one by now. And that doesn't lower your risk any major surgeries like that over time. So I'm grateful that I'm not having my first one until sometime the next year or so, because I didn't have to worry about all that and all the autoimmune. And, I got to go through COVID without taking autoimmune drugs, which wouldn't be good after transplant, trying to stay away from that. So I'm grateful that I waited till later in life. Had a pretty healthy life until I got into my late 20s, 30s, where things started to change a little bit. And I was fine really until about 3 years ago, and my GFR started to drop below 50.
Eric, I'm gonna get back to you in a second because I do want to touch on dialysis, as I know that's an important topic. I'm gonna ask Sarah quickly, was there anything about dialysis, and Sarah performed peritoneal dialysis, that maybe you weren't told in advance, or maybe something you wish you knew, or maybe advice you would tell other people that are about to start on their dialysis journey?
Yeah, so luckily, my entire life, up until my dad had passed away, he did peritoneal dialysis 4 times a day. So I was grown up just thinking it was normal, that dialysis was a normal thing and that everyone's dad did it. It wasn't until the first time I got to spend the night at a friend's house and I was like, isn't their dad gonna go heat up that bag and like do dialysis or something? And then I realized it wasn't normal. And so, luckily for me, I already knew as much as I could at a young age. And then, as soon as my dad passed away, we found out that my older brother, his kidneys were failed too. And so, I got to see him go through kidney failure as well and learn everything from him. So, luckily, in that department of knowledge, I had a lot already. One thing that I probably was surprised by is how quickly it can like knock you down. So after my first year of dialysis, I just kind of like tanked. I couldn't really, I had lost my function to urinate. It was so different and it was so weird getting used to life not feeling good when like the whole first year of dialysis, I did feel good. So I think it was just surprising like how quickly like you can go from like I'm feeling good to not.
Sure. I'm just going to actually address two questions I see here in the chat before I go back to Eric to talk a little bit more about dialysis. There was a anonymous Q&A question here about transplants and the life of transplants. And we know that transplants do have an expiration date. We also know that the immunosuppressant medication is certainly better than it was, 5 years ago, let alone 10, 15 years ago. So kidney transplants are lasting longer. But currently, there is no way to stop an expiration date on a kidney transplant, as Eric alluded to. Living donor transplants can sometimes last up to 20 years. We've had folks who even had them for maybe double that. So there's a lot of factors that go into the longevity of a kidney transplant for you. We can say, though, definitively, that because Alport syndrome is a genetic disease, it will not attack, as you hear nephrologists say, it will not attack the new kidney. So other things such as rejection or other health issues can certainly contribute to the transplant losing function, but Alport syndrome cannot contribute to your new kidney reducing in function. So Sarah just spoke a little bit about peritoneal dialysis. Eric, I believe you are on hemodialysis. Is that correct?
Peritoneal.
Peritoneal as well. Okay. Were you ever offered hemodialysis, Eric, or was there ever choice given to you about the modality of dialysis? How did you land on peritoneal dialysis?
Well, I've been doing my own research on Alports and dialysis and that kind of thing since '99. It wasn't really provided to me as an option, but I have a very good nephrologist who is studying Alports. So he's right on the front line of the information. He's younger. But it might have been mentioned in passing, but they said they wanted to try peritoneal, and I said that's what I want to do because it's done at home. It doesn't disrupt my life too much, at least not at first. Like Sarah was talking about, things change. I was only on a night cycle at first and had I had no fluid in me during the day, and that worked fine. But as I dropped from about a GFR of 13 down to about 5, we started doing 2 manuals during the day. I'm doing one right now.
Sure, yeah. Could you explain maybe for our attendees who are not familiar what a manual is? As someone who's done peritoneal dialysis, I know what you're talking about. I want to give a visual for other folks, so to speak.
Yep. At night, I hook up to a machine. It drains the fluid out of me. It pumps the new fluid in, and it goes through 3 cycles on its own. Sometimes it's 4, sometimes it's 5. They adjust that based on your prescription. During the day, I take my connector that's coming out of my abdomen and connect it to a drain bag and drain the fluid out of me. And then I hang up the new fluid bag on a pole and allow gravity to let the new fluid flow into me. And I've voluntarily chosen to do 2 exchanges on most days to split it up into about 5 hours apiece. I'm only required to do 1, but I'm sure as I get closer to, like Sarah's talking about, where you stop urinating, then the dialysis is going to have to do all the work. Because right now I'm still producing urine, even though it's probably just water. That's a lot of work that dialysis does. So I do that during the day, and it keeps my lab numbers perfect as far as like if my kidneys were still working with 3 different medicines for different reasons.
That's great to hear, Eric. Can you clarify, are you doing peritoneal dialysis every single day of the week?
Every day. Most days, like I said, we do 2. If I have something going on and I have to do 1, I'll split it up into the middle of the day. And then occasionally, if I'm going to be too busy and I'm doing something like a wedding, I'll drain out before that so I don't have to deal with it that day. So I'll have the fill in the morning off the machine. And then when it's time to leave, I'll drain out real quick. It takes about 15 minutes. And then I'll refill that night when I hook back up to the machine. But most of the time, I constantly have fluid in me working.
Great. So I think as our audience can hear in Eric's testimony that dialysis certainly does require a schedule change for you. Like a lot of your time in the day does revolve around the treatment and things like that. I'm going to segue this into another question. I'm going to address it to pay. And we had a question here in the chat that asked about having Alport syndrome, especially for younger individuals. Were you not able to do maybe some of the things that your friends were doing? So for example, Pay, were you ever maybe not allowed to eat certain things when you went to your friend's house or anything like that, or anything that your parents told you, no, 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 because of your Alport syndrome?
That was definitely certainly the case, especially, for example, in high school or in college. In Taiwan, we eat a lot of barbecue, Korean or Japanese barbecue, and we go out and it would be all you can eat protein. And then I would still go to those, those gatherings, but I would make sure that I, maintain my diet. I think it was just based on myself. I wanted to do it. I made sure I grabbed veggies as along with protein, and I have great friends. They never judge me. As as young men, people, they tend to always like to eat a lot of protein, but my young friends, they never judged me. So that was one particular moment I remember from my younger days, that I had to control myself when I was around others just eating, like you said. So
Sure. I'm going to address another question that we had come in pre. Oh, someone wanted to add to that conversation?
Oh, I'm sorry
Go ahead,
about
December, by all means.
but as far as activity, my daughter does everything. She does not she's not limited to anything. Actually, she is a junior Olympic shot putter. So and she does track, she dances. So as far as activity is concerned, she still is able to do all the things that other kids can do.
That's great to hear. Thank you, December. Pei, I have one last question for you, directed at you, actually. As a young man, have you thought about potentially passing on the Alport mutation, or is that something that weighs on you? Have you had discussions on that with your partner, or do you try not to think about that on a daily basis?
I think naturally you would definitely think about it, especially I have X-linked. So if myself and my wife, we have a daughter, then likely that I'll pass on my Alport syndrome. But as treatment methods and sort of a cure, we're working towards a cure. Everything seems to be brighter as the day passed. I think we tend to lessen that worry as we go on with our life. So we are happy to have any children that we can have, and I'm sure they'll be a blessing to our life.
Fantastic. I had a question that was both pre-submitted and it is repeated here in the chat. And our audience members are interested in knowing if you've ever been in a situation, and this is for any of our panelists, where you found yourself educating your nephrologist, maybe more than they're even educating you about Alport syndrome. So I see December shaking her head, so I'll let her start, and then I'm going to move on to Todd.
I would say yes, because one, he did not give the diagnosis. So I had to go to him and explain to him, what the ENT said. And then he knew about it because there were, I think, another set of twins that had it at our particular hospital. But I had to definitely explain a lot to him before he explained it to me.
What about you, Todd?
Yeah, I was very fortunate when I had the transplant. My nephrology team was at the Mayo Clinic, so they were, very knowledgeable about it. However, we have moved around, quite a bit, and I would say this last move here, we live in New Hampshire now. Our nephrologist doesn't know anything, about it, and I felt I was the one educating to the point now where I'm actually looking around for different nephrologists, which I think is okay to do that as well. But I still keep in touch with the Mayo once a year. But yes, that's something that's happened.
Great, Todd. I do have a question in our Q&A directed to you, so I'll take it at this time. What do you do to keep healthy living with Alport syndrome? Do you maybe focus on diet, exercise? Kind of what's your recipe for success to maintain optimal health?
Yeah, overall well-being is what I would say. I mean, I do it all. I mean, I look at it as my body gave me a kidney. It's a gift of life, and so I want to treat that as so, right? And so I do anything from I run, I bike, I do sprint. I don't do like Ironman triathlons, but I do sprint triathlons. And canoe, hike. I mean, we do it all with the family, and I've been doing that since transplant. Before transplant, I do believe that helps, in recovery, help going into surgery as well, as make sure I maintain a healthy lifestyle before. But I do very conscious about my diet as well. I've actually kind of switched from, I don't eat a lot of red meat, a lot of protein. I really keep it to, I wouldn't say vegetarian, but very close to a vegetarian diet as possible. And I've noticed that has helped. No salt, really no salt. And then my blood pressure, always making sure that's in check.
Now I'm going to actually kind of flip this question around and refer this one to Sarah. As someone who had a very restrictive diet for a while on dialysis, what are you enjoying now the most, even if they're cheat meals, so to speak, about having a much less restricted diet after transplant?
Yeah, so before, my biggest problem was phosphorus because I can't resist dairy. It's like impossible for me to not eat dairy. So when I got my transplant, actually my phosphorus dropped to like nothing. And so they were like, you need to eat dairy. And I'm like, you don't need to tell me that. I can do that. So my doctor actually was like, yeah, your goal today is to go get a pizza from this pizza shop because he's in the same town. He's like, go to Shorty's, get a pizza, get a Coke, bring that phosphorus up. And so it's just been really nice being able to actually have like some freedom with what I eat. I'm only 22, so junk food I just tend to go towards. But I definitely try to keep a very balanced meal.
Can I ask Eric, as someone who's currently on dialysis, are there any meal or meals that you particularly miss because you've been told to maybe have them in moderation or cut them out completely?
All that stuff that Sarah was talking about. The dairy is the hardest one. I found cheese substitutes. You find things that are out there. You have to find certain lunch meats. If you do have those, you just have to stay away from that stuff. Like when Todd was talking about, I've tried to limit the red meat and that, because one thing that's important to point out for those that are that are on dialysis and are looking at getting a transplant, the healthier you are when you get a transplant, the higher your chance of success, as well as your higher chance of how long that kidney lasts depends on how healthy you are. So like Todd is saying, I've been trying to do that. I'm probably in the best shape in my life in the last 10 years. Getting back to when I was younger, I'm not young anymore. So that's not easy to do anymore especially when you're a male and you're in your late 40s. It's hard to build muscle mass. Alport syndrome, as everybody knows, one of the things you do is you expel the protein from your body. So for the last 20 years, it's been hard for me to maintain my muscle as well as my immune system, and those have both gone downhill. So since being on dialysis, I've actually started to build muscle again, and I'm taking advantage of that as much as I can before I do have a transplant and have to start limiting the protein again. Because with my kidneys not producing much urine, I'm maintaining my albumin and my blood protein levels, which means my immune system is better, as well as building protein. So like Todd said, you just try to be as healthy as possible because it's your best chance for outcome for transplant, as well as keeping that kidney lasting as long as possible.
Sure, and I think you mentioned something great, Eric, about food substitutes. We're certainly told things to avoid when on dialysis, but there are things, for example, I'm about 7 years post-renal transplant, and I still drink almond milk and some of the other alternatives that I was forced to take those years ago. And after
Right.
years and years of habit, old habits sometimes, die hard, right? So, but there are a lot of fun alternatives that I did discover as a result of dialysis. I wanted to touch just briefly on some questions here in the chat regarding kidney transplant and COVID. We do know that those who are immunocompromised and the pills that one takes once they get a kidney transplant or any other transplant for that matter, they're designed to lower the immune system enough to accept the new organ, but also not get you sick, right? We do know that, unfortunately, data would indicate that folks with kidney transplants are not responding as well to the mRNA vaccines as their otherwise healthy peers. The good news is that Johns Hopkins and the NIH are continually putting out new data on this. And you can go to the Alport Syndrome Foundation website, alportsyndrome.org. We have a COVID page with updated resources. And, we hope that there's more exciting news and more guidance for our transplant patients in the near future. I'm going to stay on the COVID line of thought here. I'll address this one to Todd. Todd, is there anything that you've done especially different, in the past 12, 15 months here to stay extra safe?
Yeah, great question. This is my first in chat. I actually was diagnosed. I had COVID last March when this thing first started, and so I'll just say this: the diagnosis was definitely more scary than the actual symptoms. I was very fortunate to have pretty mild symptoms. I never broke a fever, had just body aches and fatigue for probably about 10 days, but the whole family did get it. So. And then plus that I did have the vaccine as well. So I feel like I'm a little bit more protected now. At least I hope so. But I agree, Kevin. I've read all that research as well and what's happening now with the vaccines and immunosuppressed. So, but same thing. Just mask wearing. The biggest thing for me is just washing my hands. What I run up against is I have to travel a lot for work, and so that does make for situations that just makes it a little bit more stressful. But I really am very careful about shaking hands and making sure too that I'm just washing hands. And not only that, but just putting my hands, my doctor has told me just don't put your hands on your eyes and rubbing or in your, biting your nails, little things like that that I just really, really focus on. So, and if somebody's sick, if I even have the sniffles, I really try to stay away from them as much as I can. I keep that distance.
Thanks for sharing that, Todd. December, as the mother of a child who has Alport syndrome, I'm sure the thought of COVID has weighed extra heavy on you. Do you want to talk a little bit about that, worrying about not only yourself, but your daughter as well?
Mm-hmm. Actually, we too, back in November, I got COVID, and it was so scary because her and my husband had kidney issues. So we basically quarantined, separated from them. We do believe that, of course, because we're in a house, they probably got it, but she didn't have a lot of symptoms. And she did well. But what we do now is I just make sure, again, like I have to educate her when she's out, make sure she has her hand sanitizer, make sure she's wearing her mask. Even when her school went to school at the end of the school year. So just making her teacher informed, making sure that she's, keeps her distance and kind of reiterating that for her so that and then too, like, again, let her know, if something happens, this could be the possibility of it. So this is why we're doing all these precautious measures and stuff. So.
Great. Thank you for sharing that, December. I'm going to turn the question over to Sarah. As someone who just received a kidney transplant in the past few months, was there anything that your kidney team or transplant team, I should say, told you specifically to do and not do in this COVID climate?
Yeah, so luckily I got my vaccine before I got my transplant, which they told me was a lot safer because I wasn't on the immunosuppressants yet, and that my body had accepted the mRNA vaccine before we had, put a foreign object in my body, basically. So I was fortunate to get it before, and they told me to keep wearing masks, keep being really clean. Basically, all of the measures that we were doing during quarantine, just keep doing it, even if other people aren't, and to make sure that I'm keeping my distance, wearing a mask, washing my hands, just staying safe, not going anywhere unless I need to, not being in big crowds, just doing everything I can to stay away from anyone who is, sick and stuff. So luckily I was able to, get the vaccine before, but I think it's good for people to get the vaccine, even if it's after.
All right. Thank you for sharing that, Sarah. I want to ask you a question related to dialysis and transplant here. As someone who was on peritoneal dialysis for a while before receiving your transplant, did you ever go on vacation or take a long weekend or anything with all of your dialysis supplies?
Yes, and it is a big hassle. It sucks. I hated it. I started dialysis about 2 months before I went to my freshman year of college, and I decided to go to a college that was across the country. So I had to fly with my machine, my nighttime cycler machine. I had to order dialysis to be sent to my house at home before I came home. I had to coordinate rides and people that would be able to pick me up and take me, and people that would be able to lift my machine for me in the ginormous suitcase. I had to bring like the dialysis caps. I had to bring gauze. I had to bring band-aids for my catheter. I had to bring everything. And then plus my clothes. Basically, just traveling with the machine is incredibly hard. But I did do it quite a few times and I had gotten used to it. It's just a lot of stuff to carry, especially I'm very small and I don't have like muscles or anything. So it was like I struggled, but we did it and I hated it, but I
Well,
wanted to go
let
home.
me ask you this, Sarah. I've taken my machine back in the day. I drove to hotels and had my car back seat and trunk filled with supplies. Let me ask you though, how good did it feel to be able to go on vacation at least for your own mental health? You want to talk a little bit about that? How those little, as stressful as those vacations can be with all the supplies, it still felt great to be able to do them, right?
Yeah, so as much as like dealing with the luggage and the machine and the dialysis bags was stressful, it was so nice to like get out of my room, get out of the place that I was forced to spend 10 and a half hours in every night and like basically just
Mhm.
like get out of the place where you feel the worst because you're stuck there, and just like not not be in that place and to just really get out and do something fun, be outside, actually feel the sun on your face, like stuff like that.
Yeah,
Thank
that
you,
is a
Sarah.
benefit. That is a benefit of peritoneal dialysis is you can have somewhat normal life during the day. You don't have to go to a clinic for 4 to 8 hours, 3 times or 4 times a week. You have somewhat of a normal life. And like anything else in life, we run a wedding business, so we do travel a lot for those, and you just get used to it after a while. It's just something that you do. That's part of your luggage. You take that with you. You figure out how much you need to take with you, and it becomes a habit. You know exactly what to take and how much to take, and it's just something that like anything in life, when we go through things, we're glad to be alive and still somewhat healthy, considering, and be able to have a normal life compared to clinic hemodialysis.
Eric, in my experience, the first time I traveled with my peritoneal dialysis machine, my college roommate won concert tickets to something out of state, and it was a festival. And he's like, "Are we going?" And I think had it not been a situation like that where I was like, "I can't miss this. I don't care that I'm on dialysis."
Right.
That finally spurred me to make this decision. And then I think people who do take that risk and travel and just understand all that, they'll do it multiple times. It's just a matter of doing it the first time, then saying, "Okay, I can do this. It's tricky, but I can make it work for me." And making dialysis work for you, is always the most important really part of that. We don't have too much time here, about 2 minutes left. I'm going to have one last quick question for Pay, and this is about someone being on medications for Alport syndrome, and if you've experienced any side effects, Pay, and if they've in any way affected your quality of life.
Definitely. So first of all, I think for ACE inhibitors, obviously it drops your blood pressure. You feel drained, you feel more fatigued. But I just make sure whenever I take my ACE inhibitor, I always drink lots of water, stay hydrated throughout the day. I always fill up all my water bottles that I need for the next day, the previous day, so that I make sure I'm keeping track of how much water I drink. And then regarding side effects as well, I had to take medication for my uric acid because I had higher uric acid. And the first medication I took was allopurinol, and that did not work for me. It dropped my uric acid, but I had rashes all over my elbows. So I had to change medications for that uric acid. But just in general, I think I would just recommend be very careful if there's any rashes or any side effects, and then talk to your doctor about alternative medications.
Excellent. Thank you for that, Pei. I think you mentioned a great point. If you are experiencing side effects, it's important to have that dialogue with your nephrologist. They're not mind readers. It's important to let them know what you're feeling, and maybe medication dosages can be changed, or maybe the medications can be changed entirely. So thank you for sharing that. With 1 minute left, I would just like to thank all of our patient and caregivers on this panel today. You all really educated me as just the moderator here, and I'm sure you educate our audience members on a lot of the aspects of day-to-day living with Alport syndrome. I hope everyone who has joined us for this excellent panel will stick with us. In about 15 minutes time, we're going to be having our major Your Role in the Alport Research Roadmap session, where my colleague Lisa Bonebrake, the Executive Director of Alport Syndrome Foundation, will be making 2 major groundbreaking announcements. You do not want to miss that session. Thank you again to all of our great guests here today, to Pei, Sarah, Eric, December, and Todd. Also, thank you to John Whitworth for this excellent illustration. We'll make sure that even post-event, everyone will be able to check out this excellent visual illustration of the insights we learned in the past 45 minutes. Thank you again, everyone, for your participation in the session. Thank you for the great audience questions. And we'll see you in about 15 minutes for that Alport Research Roadmap panel. Thank you all.